Welcome to the Increasing Language Access in Oregon Learning Module Series. This Learning Module Series presents content from a resource called Increasing Language Access in Oregon, a Workbook for Providers, which is a plain language, actionable workbook focused on meeting language needs in healthcare settings. There are a total of 7 modules in the series, all of which are intended to be alternative format materials to the different chapters and appendices of the workbook. All recorded modules are available on the OHA Transformation Center website. This module focuses on Chapter 2 of the workbook, Defining Credentialed Interpreters. Chapter 2 defines what it means to be a credentialed healthcare interpreter in Oregon and why to work with one. The chapter outlines Oregon's requirements for becoming a qualified or certified healthcare interpreter. It walks through the qualifications, testing, and standards set by the Oregon Health Authority and explains why these credentials are so important for ensuring accuracy, trust, and compliance. It describes the training and testing process interpreters must complete, the difference between qualified and certified, and how interpreters are listed in the Healthcare Interpreter Central Registry. It also highlights the importance of working with credentialed interpreters. A credentialed interpreter is someone who has met specific eligibility, training, testing, qualification, and/or certification standards with their language and interpretation knowledge and skills. These standards are in place to make sure interpreters have the language and interpretation skills needed to provide accurate and ethical communication in healthcare settings. These credentials help maintain a base level of quality across all interpreters statewide. So why does this matter? Credentialed interpreters help ensure accurate and effective communication between providers and patients. They protect patient safety by reducing the chance of misunderstandings or errors that can affect care. Working with credentialed interpreters helps your organization comply with Oregon law and OHA requirements. And finally, credentialing helps build trust with patients. It shows respect for their language preferences and needs and reinforces that their care experience matters. There are 2 main types of credentialed interpreters, qualified and certified healthcare interpreters. We'll discuss first what it takes to become a qualified healthcare interpreter, or qualified HCI in Oregon. To qualify, interpreters must meet the following requirements. They must be at least 18 years old and have at least a high school diploma or GED. They must not be listed in the Medicaid exclusion database. They must demonstrate language proficiency in both English and the target language. This proficiency can be shown through education or through an approved language test. And they must complete at least 60 hours of OHA-approved training. Interpreters who already hold other professional certifications may only need an additional 20 hours of OHA-approved training to meet Oregon's requirements. The workbook includes a link to the Oregon HCI program guidance, which lists approved trainings and certification pathways. Qualified HCIs play a key role in providing language services, and understanding these requirements helps ensure your organization works only with interpreters who meet the state's standards. Now, let's look at certified healthcare interpreters. Certified interpreters must meet all the same requirements as qualified interpreters, but they also have to pass a certification exam from an approved organization. Certification demonstrates that the interpreter has been formally evaluated for both language proficiency and interpretation skills, and it reflects a higher level of professional validation. Both qualified and certified interpreters are essential to Oregon's healthcare system. The key is to ensure that whoever you work with has the appropriate credential for their role and the languages they interpret. In addition to certified and qualified interpreters who communicate with individuals who speak a language other than English, there are also sign language interpreters for those who are deaf or hard of hearing. Sign language interpreters in Oregon must meet OHA's certification and proficiency standards. This includes holding current certification from one of the following organizations: the Registry of Interpreters for the Deaf, the National Interpreter Certification, or Certified Deaf Interpreter Credential. They must also pass a sign language proficiency exam, such as the American Sign Language Proficiency Interview or the Sign Language Proficiency Interview at a minimum advanced level. Finally, they must meet all OHA credentialing requirements that apply to other healthcare interpreters. More information, including specific requirements to become credentialed as either qualified, certified, or sign language interpreter, is available on Oregon's Healthcare Interpreter Program website. This concludes the module focused on Chapter 2. To summarize what we covered, credentialing ensures quality, safety, and trust in every interpreted encounter. Oregon's credentialing framework for healthcare interpreters sets clear standards that protect both patients and providers. In Chapter 3, we'll build on this foundation by talking about the steps and best practices for providing interpreter services, including how to document good faith effort and overcome barriers such as scheduling and interpreter shortages.